Thank you for showing up. There's a lot of information, but I will tell you this, Standard Insurance is not here today. So we're not talking about the dental, life, disability. Nothing has changed on that, including the rates. We're on a rate hold on dental, so whatever we had last year, we have this year. You do not need to fill out a new form for Standard unless you're making changes. If you're making changes, then yes, you fill out a new form. But for the medical, we are now going to Pacific Source from Providence. We needed to make the change, as you saw in the email from Rick and myself. Providence came back with a 19.9% rate increase for our plan that we did have with the base and buy-up. And pretty much, we couldn't afford it. And so we looked at other alternatives, and what's going to be described to you today is the other alternative that I think actually will make it affordable, but you're going to have to pay attention and make sure that you use your money wisely, staying in network. Don't go out of network if you can avoid it. If you can, afford to put away money into your Manly account, the flexible spending account, you'll make the most out of your money. So for right now, I'm going to give you the floor.
I'm Cindy with Pacific Source. And that is Liz Manley back there with Pacific Source Administrators. And we're going to kind of dovetail back and forth, but I'm going to talk to you about your medical. And I want to do a high-level overview. I won't get into the weeds too much, but I want to answer your questions. So I'm absolutely open to dialogue. That's my goal, especially transitioning to something new. The numbers might look different. So I don't know what the Providence plan looked like, but I'm going to speak directly to what this plan looks like and how we're going to work together with you all.
So hi guys, I'm Marvin Revolto, I'm the owner, and I've had the privilege of working with your organization for a number of years, and we still want to say thank you very much for trusting us. When we took a look at what was happening in the marketplace as a whole, one of the ideas was how do we save money and how do we maintain the benefit level that best fits this culture and best fits what you can afford. So we look at two areas. One of the things that I want to talk briefly about is the Affordable Care Act. People call it a lot of different things, some of which we can't even repeat. So the Affordable Care Act is fully operational at this point. It began in 2010. It is fully operational right now for 2016 in the sense that later on this month, HR is going to send out information to you asking you questions about how you're insured in your family, who has insurance and who doesn't. It's a requirement. It's called shared responsibility. This is implemented and being watched by the U.S. Department of Treasury. Our friend is also known as the IRS. They're requiring it. The Centers for Medicaid and Medicare, the reason why they're involved is they want to know who is responsible for your insurance. Is it Medicare? Is it Medicaid? Is it the employer? Or are you as a private consumer responsible? That information is going to have to be collected by every employer in America. The insurance companies are required to send it out first to the employer, and they're going to send it out to you. You're going to bring it back, and they're going to, they being the employer, is going to send it to the IRS. It has to be to them by February 28th. The reason why is it's going to let the IRS know who to fine up to $300,000 or more as an employer, and who not. Those employers with 51 employees or more who do not provide insurance for their employees will be penalized this year, being 2016. So when you get this paperwork in, don't get mad at Carter. You get mad at me.
Thank you.
The IRS is requiring it, and that makes it fully operational on this side of it. One of the things we took a look at was developing a plan using a health reimbursement arrangement. What it allows us to do was negotiate a rate based on a $5,000 deductible, which you won't see. It allowed the organization to save money, which they can then use to help cover a deductible portion and a maximum out of pocket that you were paying before in order to keep the same type of out of pocket for you as employees. What we were looking at, all things being equal, was a way of saving about $140,000 a year. in premium and still have you maintain the same level of coverage you had before. So it will look different. But the idea around it was to have you not have increased deductibles as much as possible and increase the maximum out of pockets as much as possible. So that's why most of this is going to be around the representatives both from the new carrier, which of course is Pacific Source, and Pacific Source Administrative Services. We're adding something to it. So you have a 125. That's a flexible spending account that says I can take money out of my checks pre-tax to help pay for premiums, out-of-pocket maximums, deductibles, those types of things. But there's going to be a new part added to it called a health reimbursement arrangement, which says for those deductible expenses that you'll incur, the organization is actually going to pay those expenses after a certain level, okay? So we've had this in a number of our clients for about 10 years. They work really well. The key is in-network and out-of-network, where you get the best bang for your buck. Fortunately, we're in the Lane County, Eugene, Springfield area, where about 97% of all the doctors and all the hospitals that I'm aware of and all the clinics that I'm aware of are participating providers. It's not like when we're working with clients in Portland where their hospital and doctor wars are strong, where you have real issues and upwards of $20,000 of maximum out-of-pocket for out-of-network providers. We don't have that here. So, questions about what we were looking at and why we did it. Okay. So, plan design.
Yep. Okay, so I'm going to have you guys open up your packet here. Liz, can I just ask you what the health reimbursement arrangement amount is going to be so I can speak to that effectively?
So the employee is responsible for $1,400
Of the deductible?
Liz, I want you up here. You can come up here. We're taking this.
Okay, so you guys are responsible for $1,400 of the deductible. So when we're looking at the summaries, which is what we're going to pull out here, the medical benefit summary, I want you to keep in mind that the deductible looks that way, at $4,000, but the health reimbursement account, which Liz will speak to, will shift that quite a bit for you. Obviously, it's $1,400 deductible, okay? So the name of your plan is the PSN balance. The PSN stands for Pacific Source Network. I'm here to tell you and echo what Marvin said, 97% of your providers within Lane, Lynn, Benton, all the way up are going to be Pacific Source Network providers. That includes all of the hospital systems outside of Kaiser Permanente. So you have everyone, if you need specialty, Providence, whatever docs you're with, most likely you'll stay with those docs. With that being said, there's always that one. So do yourself and us a favor and make sure that you go online. I'm going to just hit this right out of the park right now. Go online to pacificsource.com. At the very top it says find a provider. Click on that and just type in your doctor's name. If by chance you don't find your doctor on there, by that miracle, will you please pick up the phone and jingle one of these customer service numbers right here and just say, can you just tell me my doctor's in network? There are a lot of times what I found on my own personal story was that I typed in my doctor's name and he had some funky middle initial or it was spelled different or his first name was long Timothy and not Tim, and it thwarted the whole system. So just in case, give a jingle if you don't find their name, okay? So we're going to look at the two columns, participating and non-participating.
What is that paper?
This is inside of your member guide.
I see it.
Inside.
It wasn't there.
Oh, this is the PSN balance. I can give you this one. Every packet should have one inside of there. I apologize. I'll just give you these, and I'll grab a new one. Do you all have those?
Oh, okay. So you're telling us.
Okay, so at least most of us are looking at that. Okay. Okay. So we're looking at the benefit summary here, okay? We've got our participating providers. What I want you to see right there at the top, anything with an asterisk next to it means it is not subject to the deductible. You don't have to come out that $1,400 out of pocket before services are taken care of for you. Everything that says no charge is truly preventive, and that is no charge. That means for all of you ladies, you have your Well Women's exam. Gentlemen and ladies, new benefit for all of you that you wouldn't know, but this is a new benefit and something that's exciting for Pacific Source, is that each one of you will be eligible for a routine physical every year. Now what that means is not I'm feeling ill, I think I better go get a physical. It means I'm feeling good, but I want to get checked. So you get a physical that way, okay? So that's available to everybody. Routine mammograms, ladies, this is not when your doc says, hey, I think I want you to get a mammogram. It's, I'm going to have my preventive mammogram. And that language sounds different when we're booking that mammogram versus when they're asking us to book it. So you're doing preventive medicine here, okay? If you are blessed to be 50 to 75, your routine colonoscopy is thrown in at no charge to you. And what that means is that your colonoscopy is covered at no charge. Should there be a need to have any lab work done, that will then fall to deductible and coinsurance, but for the sake of the procedure, it is covered at no charge to you.
That's after 50, you said?
50 to 75, correct.
How often?
Okay.
Routine meaning how often?
Routine meeting once every 10 years.
Okay.
If the doc comes in and says, I want you to come in every 2 or once annually based on family history, I would love to have a dialogue with you about that, because sometimes family history can thwart that benefit to be tapped into earlier. So we'll discuss that on a case by case, okay? Immunizations, obviously covered at no charge. Well baby visits, no charge to your kiddos should they be on the plan. Your professional services, your office visit copay, naturopathic visit copay, specialist visit copay. Those are all going to be $30. What that means, you make your appointment, $30, and then we usually have, if it's a participating provider, we have a negotiated rate with them when we pick up the rest, okay? Office visits, you'll see all down here. Your office procedures, I beg your pardon, supplies, surgery, outpatient, all of these are just going to be your deductible and then coinsurance. One thing I want you to look at the very bottom where it says diagnostic and therapeutic radiology and lab. Do you see how it says no charge up to the first $500? That's your basic lab and x-ray. Essentially, you have a bank of lab and x-ray available to you for that is worth $500. What's great is during that preventive physical you're having, or maybe ladies during your Well Women, they want to run a couple extra basic labs. That falls into that first $500. So you're not going to be out of pocket for basic lab that first $500. Once that $500's met, then we begin cost sharing on that. But that's a nice little perk to know that, okay, I'm really not feeling well, I need to get in, I should have a throat swab, I might be sick. That throat swab will most likely fall under that $500 benefit. Yes, ma'am?
Okay, the way this is worded is a little bit confusing.
Okay.
Let's say we have a post-transplant patient that has to go in quarterly for blood draws,
Correct.
that type of thing. This says up to the first $500, then the deductible, then the 30%.
So what that would mean is
everything
that,
after that $500, we're paying out of pocket until we get to our $1,400.
that is correct. Before we begin cost sharing with you, where we pay 70, you pay 30. That is correct.
I have another question.
Sure.
Is the $500, is that per person?
It is, per person.
So if you have dependents or spouse?
Absolutely. They
$500.
each get that $500 bank of lab. Comes in handy when you have little kids and all of a sudden you're wondering if you need an x-ray for a broken bone. That will fall under that basic lab and x-ray. Now, if we're talking big scans like MRIs, CTs, PET scans, thank you. Those would fall under the advanced diagnostic imaging. Those are going to be $100 copay per test, and then we cost share with you on the rest there. Okay. On the back side, you'll see your urgent care visits. Those are going to be a $30 copay, and you'll notice the bump here. For emergency, it's $250. Now, you guys being in Lake County have access to quite a few urgent care centers. So this is where I'm going to help you guys to just tap into your mind, save that money. If you can get into an urgent care and avoid the ER for your own sanity and for $20 of savings for a copay, try to the urgent care first. Here's what happens. If you go to the urgent care and they defer you on, that $30 copay is end up going to transfer to the ER, so you're not gonna be any more out of pocket there, okay?
You don't have to pay the $250 there, if the urgent care refers you.
You would just pay the $250 and not the $30, and if you paid $30 at the urgent care, then you pay the $220. And we work out the details on the back end, and if there was ever a question, it's one thing I will say, if you ever have a question, if coding doesn't seem right, if something seems like it just isn't right, please call our customer service. You are not experts in medical coding, and that is not your job, that is ours. So we will gladly take care of you if you call our customer service. And I'm gonna keep talking about that, but our customer service is award-winning. I call them from the road with questions that you folks have at meetings all the time. I mean, it's quick, and they're a human being on the other end of the phone, okay? Maternity services are gonna be deductible and then co-insurance. Mental health and chemical dependency services. Could I have a question? Yes, ma'am.
Another question regarding, let's say an annual pap smear, or every other year pap smear, did you go in and pay your copay for your
Nope.
physician?
No, that's annual for you. It's an annual visit at no charge to you.
Okay, but what about the analysis of the tissue sample or that type of thing?
So if that's a lab, that could potentially fall into that first $500 bank, unless you've already reached it, and then of course we begin cost sharing with you after deductible.
Okay, so that all kind of goes towards that $500.
Yep.
Yeah.
It's a little bump to make your prevent, see, if you're healthy people and you're getting your preventive visits done, and ladies, you're doing your annual exam, and ladies and gentlemen, you're doing all of your physical routine, your exams. What the $500 bank is there for is if you're healthy and they just want to run a couple extra things, it's not going to cost you out of pocket to do those first few things. Does that make sense? That's why it's built into your plan. Healthy people love that. Unhealthy people like myself sometimes appreciate it, and then we begin cost
So
sharing.
it's not considered a procedure and supply situation.
I beg your pardon?
It's not considered a procedure and supply situation.
No, that's considered a laboratory benefit. And again, if you get an explanation of benefits and it doesn't feel like it's the right lingo or language, please give us a call so we can talk it through with you and at least explain. Or, you know, providers do make mistakes as well. A lot of times we'll do some recoding with them and we'll get back in touch with the provider on your behalf. Sometimes you'll have to as well. So it's a partnership for sure. Lastly, we'll talk about mental health, chemical dependency. Those are a $30 copay. There is inpatient and residential programs available. Allergy injections, Derval, all of the rest is here. Those are the high-level overview. You can see it is worth it to go to our participating provider.
Okay, 2 questions.
2 questions. Number 1.
The asterisk, it's not subject to the annual deductible, but it is part of the maximum out of pocket?
That is correct. So that's a great question. So your out-of-pocket is going to be a true out-of-pocket. Consider a bucket. You have a bucket of every dollar that you pay for this plan, and I'm not talking about premium, I'm talking about a $30 copay, a prescription drug, co-insurance, deductible portion. Every dollar that you spend goes into this bucket. When you reach that $6,000, and that's of course with your deductible and with the HRA, and Liz will get into that part, she's the expert there. Once that bucket is full, you're done for the year. Unfortunately, and fortunately, for my family, we reached that out of pocket last year, and it was really nice because all of a sudden in May, after we'd gone through tonsillectomy and every other thing we went through, we were done for the whole year. I went to go pay for an antibiotic and it was $0. So just know that it is a genuinely true out of pocket. Thanks for bringing that up, Art. Appreciate
Part
it.
2,
Part 2.
out of network. So I'm traveling, I'm in Eastern Washington.
Awesome.
I get hurt or sick.
That is such a great question. If you are hurt or sick anywhere outside of a service area, and it's an urgent or emergent situation, we will cover your visits wherever you go as it was a participating provider. And that is an emergency, urgent or emergent benefit. So it's not, hey, I'm in Minnesota visiting my aunt and I decided to go get a doctor visit. That is not urgent or emergent, but you get it. I just want to give you real life examples. Yes, ma'am.
So, I have a question. I'm sorry.
Oh, you both did. Okay. Either one. Either one.
So my granddaughter goes to school in Rhode Island.
Okay.
On my
Yep.
insurance. So is she covered? I mean, can she go to the doctor there? Or
She can, so that's definitely something I'd love to talk with you offline about, just because, unless there's multiple people in that situation
There are.
here.
Let's talk about the national network.
Okay, so we have a national network, so on the back of your card, you're gonna see, if you flip your card, you won't have it now, but when you get it in the mail, or you print out a temp ID card, it says First Health Network. So when you log into PacificSource.com, there's gonna be a map of the US. Click on the state, and it will take you out to our national network, to which you can type in a specialty, a zip code, say within 10 miles of this zip code, give me every provider. I just did a DC search for one of our members that has a dependent in DC, and there was 948 participating providers within a 10-mile radius of Washington, DC. So the national network is very robust. To dovetail off of that, if there wasn't a doc in her vicinity in that network, we tap into an additional network following that. There is coverage across this country for you all. If you were to travel internationally and become ill, and it's urgent or emergent, and you're usually seen at a clinic, they always ask you to pay. That's normal. Submit those claims when you get back to the US to us, and we'll pay it at a participating level. Okay, that's how it works. Yes, ma'am.
So just going back to what you said, so prescriptions count towards that $500 deductible?
No.
No, they count toward the out-of-pocket maximum.
Okay, so the $1,400?
No, that's your deductible. That's okay. So your deductible is your portion. It's essentially like your investment toward this process.
Okay.
We'll cover a whole bunch of basics.
Okay.
And then if it gets nitty gritty, you cover that first $1,400. Company will come in and help you with the rest of it. But that out of pocket is every single dollar spent, regardless of whether it's your money, ours combined, we're cost sharing. All those dollars, once they hit that $6,000, you're done. Does that make sense?
Yeah.
Okay.
One more question.
Yep.
A little variation on what Mary was asking.
Okay.
Who has dependents that live somewhere else. We have a couple of employees that live in different states.
Oh, yeah,
Same deal?
absolutely.
National network.
And I'd love to know what states they're in, because what I can do is do a query of the network in those states within their radius, and just at least send them a link or something so that they can be familiar with what's available to them. It'll hone it all the way down to urgent care clinics, hospitals, providers in general medicine, in cardiac medicine. I mean, it gets deep. So if you want to, I'll be glad to send benefits and links and things like that to those folks as well. Okay?
So one of the things that I wanted to explain that I'm not sure if it's coming across clear, if you had something really big happen to you, the first $1,400 towards your deductible is out of your pocket. The next $2,600 is going to come out of the HRA. If you still have remaining dollars, you're accountable for the next $2,000 to meet that maximum out of pocket. Yeah, it is different than last year. Last year, your maximum out of pocket was $3,750, and that there was no in between. There was no company coverage in between. Your deductible was $1,250, and then the rest of it was yours until you hit the maximum out of pocket of $3,750. With the plan we set up, it's $1,400 yours, $2,600 HRA, $2,000 yours, and then everything's been covered. So you're down to $3,400 for your maximum out of pocket from $3,750.
And that includes your co-pays too. So those dollars are
Does that make sense?
Yep.
You reduce your maximum out of pocket.
for sure.
My question is, how does that work? So are you gonna need, is the employee gonna need to pay that full amount?
That's a
and get reimbursed?
Good question.
We're gonna
That
get to
Liz
that.
is gonna get into.
How does that work?
Right, Liz will get into that.
That's the next part we added to the flexible spending account. So we're gonna talk about that.
Yep, it's a lot of moving pieces, but I want to make sure you guys understand the medical, then we're going to talk about the financial, so that you guys can get the full picture, okay? Okay, so we're done with medical, but we're now going next to prescription drug coverage. So you'll see here, tier 1, tier 2, and tier 3. If you don't know what tier your drug is currently that you're taking, or you know, oh yeah, I pay a lot for my drug right now, I always say do yourself a favor, because I think that's what it is. Go on to Pacific Source under find a drug. So right at the top, find a provider, find a drug. You can type in your drug name. It tells you that you're on the ODL, that's the Oregon Drug List. It tells you right there on the top of your summary. And so you'll just have to click that box that you're on the Oregon Drug List, type in the drug name. It'll tell you what tier your drug falls on. Okay? So it'll outline it for you. If you're taking a generic drug, you can see here that a 30-day supply is going to be $10 if you go to a retail pharmacy. But if you look just below that, you're going to see a 31 to 90-day supply is also going to be $10 via mail order. We partnered with a company called Well Partner, and if you take maintenance drugs that are typically, I mean, you can take maintenance drugs that are in all tiers, but typically we try to get our maintenance drugs generic because we take them every month, right? And so a $10 supply, a $10 copay for a 90-day supply will be delivered to your door, eliminating 3 trips to the pharmacy and $20.
Wow.
So it's definitely a good value. Our family, with the 6 of us in our family, I can tell you that 2 years ago, we saved $490 using mail order pharmacy. So it is worth it if you're taking, well, we had 6 people, but I'm just saying, if you're taking many drugs and they're generic, and if it happens to be that your generic comes in at a $4 copay, please make sure you run your Pacific Source card, and we'll charge you the $4 copay. We're not going to charge you $10 if it's a $4 copay, okay? So you'll see there your prescription drug coverage. You can see your tiers. Make sure you go and check your drugs to see what tier they fall in. Of course, if you don't want to do it online, you can always call and say, I'm coming onto the plan. I'm going to be new. This is the drug list I'm on. Please help me with my drugs.
If we're already with Well Partner, because they're part of our Providence plan, do we need to make any notification?
Nope, you do not, other than just let them know that your 90-day script is going to, I mean, you'll send in the 90-day scripts that probably, most likely, the doc will write you a new one on the calendar year. I know we ended up doing that. You might not need to. I would definitely send them a copy of your card that you have a new insurance program though, for sure.
Yeah, let everybody know you have a new insurance company, because otherwise they'll fill the old insurance company.
And then you'll stand at the counter and wonder why they're not paying. One thing I want to just give you guys a tip. Make sure you fill your prescription drugs before the end of the year, because it's inevitable that when shifting and our pharmacy benefit manager shifting all of you to a new group and a new identity within the system could cause some hiccups. I don't want it to, but just in case that emergency supply for you would be a great idea to have that. Just fill them up just before the end of the year, if possible, okay?
It's kind of like when your car's about to go off the warranty.
Go get everything
Brakes
done.
on.
Okay, so any questions on the prescription drug coverage? All of these copays go toward your out-of-pocket, just so you know. Okay, next we have chiropractic. You see on the medical plan, you'll notice that naturopaths fall under your medical plan. So if you do see a naturopath, they will not come out of your alternative care benefit. Okay? So this alternative care packet, this is nice. It's a $1,500 bank for your alternative care. I have two things to tell you about it. Number one, make sure you see a participating provider. Joe's Adjustment Shack might charge you a little bit more than a participating provider would, and that's going to come out of that $1,500 bank. The second tip I have is that if your chiropractor suggests taking a spine x-ray or some lab of some sort, ask him to write you an order to take to the medical side of your plan. And the reason why is you have a $500 bank for basic lab and x-ray. You can tap into that and not tap into that $1,500 bank that you have for alternative care. Okay? So you have a $1,500 bank, acupuncture and chiropractic, naturopath falls on medical. Any questions on alternative care? Yes, ma'am.
What's medically necessary? It says for medically necessary. So what is that?
That's a great, so you are hurting, you feel tight, you're going to the chiropractor for a medically necessary adjustment.
So you don't need like a referral?
No, there's no referral.
0 referrals required. Sure.
The ACA, part of the things that alternative care providers are going to have to learn how to do right now, they're gonna have to learn how to use ICD-10 codes and CPT-4 codes. For diagnostic related issues, they're gonna have to diagnose an issue and treat the issue. That's something that they've never done before. But because the ACA says there's no discrimination rules about providers, there's rules about how it's covered. So I don't go to my MD anymore. I go to my naturopath, I go to my acupuncturist. They now bill using medically necessary ICD-9. On the short side of it is, it's not a feel-good massage anymore. It's because you have a condition, this is treating the condition, and they're billing it that way. So that's what medically necessary really means. They have to learn the codes now in order to bill. Because now they're into the medical and the insurance side. The insurance companies want to see those codes.
I will tell you that, oh yes,
There's no copay for the alternative.
there is. It's just gonna match your basic $30 copay. It's gonna match that copay. Okay? This is a separate $1,500 bank. This isn't your medical that goes toward the out-of-pocket, just so you know. This is a $1,500 bank in and of itself for alternative care. And it does say massage is not included, and that is real. Unfortunately, my daughter, unknowing that it wasn't, went in and had an adjustment, and then they sent her to the massage chair for 15 minutes follow-up, and I got a bill, because it is not covered. So I'm letting you know, if they send you to the massage chair, just keep in mind, that's gonna be on you, and that won't be covered, and I got to learn my lesson with children. Yes,
So that $1,500 bank, once we've spent it, then the rest is all out of pocket.
that is correct. Another reason to use a participating provider, because we have a negotiated rate with them, so it'll be bigger bang for your buck.
And I did an analysis on services of that $1,500. If you use an alternative care provider every 3 weeks, i.e. me, every 3 weeks, $1,000 goes into September, $1,500 goes into the end of December, 1st of January. Every 3 weeks. So that's what $1,500 will do. And I use a participating provider. And she bills it out. I pay my co-payment and that's it. But before I changed my plan this year, starting in October, I had to pay out of pocket because I was out of money.
So I'm just gonna, as I'm sitting here listening and thinking of $1,500 going that far, and I'm about to speak to your vision benefit, and I'm looking at a prescription drug, and I'm thinking $3,400 out of pocket. I just need to say, like, just in the industry, you guys have an incredible, very rich plan. I work for Pacific Source. I have no issue saying, I have a $500 chiropractic limit. Like, it's just, you guys have a very, very good plan. So, I'm out doing this stuff all day long, and I'm just sitting here thinking and doing all of it. Oh, Vision 3, this is really good. So anyway, you guys have great coverage. Just wanted you to know, they're taking very good care of you here. Vision benefit summary is the last thing I'm the last thing I'm gonna speak to. I always find something else to say, but Vision 10-300. Your copay for a vision exam at a participating provider is $10. Your hardware is gonna be a $300 max.
Per year.
Let me look just to make sure. Every one vision exam every calendar year, one pair of non-collection glasses, lens, and frames per calendar year. I'm not sure what non-collection means. It's
Not 24 months.
What's that?
Not 24 months.
No, it's every year. A $300 bank for your glasses. So if you are like me, I would love to give you guys tips, partially because my children cost me money. I do the $10 copay at my optometrist office. And then I leave and go to Costco and buy my glasses and then submit a claim. And you can do that this way, because the glasses are a lot less expensive there. You can take your prescription. So just a tip, if you like your optometrist and you love getting your glasses there, it's totally fine. Just letting you know. That's an option, okay?
So I'm still not clear what non-collection frames
So, yeah,
plays
so-
into the 300 maximum. Sounds like you could get a pair of, collector frames so long as you don't, if you're willing to pay whatever goes over 300.
So here's the deal. A lot of times people, the non-collection frame is sort of a deterrent. You can get whatever frames and you're gonna get $300 reimbursed to you. Okay?
I shop at Costco too, but.
Yes, no, I
these
totally
two
get it. I
these
mean,
two pieces of information don't
you can
exactly-
buy a pair of Ray-Bans and get up to $300 members, okay? Okay, the last piece of paper in your member guide, I'm gonna talk about 3 more things, is your preventive care summary. These are all of your essential health benefits available to you at no charge. This is part of the ACA. I will say Pacific Source added in the physical exam available to every member each year. And we also added in a in-office, inpatient, or outpatient vasectomy to gentlemen at no charge. Additionally, you'll be able to get a little bit more detail on your colonoscopy benefits. Tobacco cessation is covered at no charge to you. Multiple quit attempts are available should you choose to access that. Sterilization, contraception, breastfeeding, immunizations, routine physicals, well woman visits. All of these are your essential health benefits for 2016. So you can read over that. Just wanted you to know these are all available at no charge to you. Yes?
Routine physical, also sports physical.
No. So, football.
Even if you just go once a year?
I have, yeah, right here. So, football, here's what I say. I'm bringing my child in for a physical. And then I sit with my doc and say, so I'd like for him to play football. And he says, oh, okay. And I said, so is he good to play football? And he's like, absolutely. And I said, great. Can you sign that for me? Because I need him to play football. Like, I have to have a physical. And so they always code it. Our docs are so great. They will code it for a physical for your child. Okay? But just please don't say it's a sports physical because they'll bill it.
Say that word.
Yeah, we just don't say sports physical in our family. The physicals are going to be, so I'll talk about that. Your members age 22 and older are covered once per year. Well child visits are going to be your, from birth to 3, you get your 12 visits. And then from 3 on, it's a well baby visit up till 22. And then at 22, we kick in and you get your routine physical every year. It's all outlined down here so you guys can see exactly how many physicals you get. Okay? Guys, physical therapy, where does that fall? Physical therapy, let me just look to your medical summary real quick.
It is deductible.
It is deductible and then co-insurance. Okay.
So physical therapy is deductible. Co-insurance.
Yeah, sometimes it has a little wonky. I just didn't want to speak to it wrong there for you. Okay, inside your member guide, just a couple more things. You know here that I told you about customer service. Once you get your ID number, which you'll get a master sheet of everybody's identification number. In the event that your card doesn't show up on 1/1 and you need to go to the doctor, Barb can give you your ID number. You log into pacificsource.com, put in your ID number, print a temp ID card. It's as easy as that. Okay? One thing I will tell you, log on to Pacific Source. I'm like big on Pacific Source, but it's like the real tool that really will be helpful for you. Is once you have your ID number, create an InTouch for members account. That account will be awesome. All of your explanation of benefits will be available electronically to you. That would be a huge deal with your HRA because those need to be for that health reimbursement. All of your explanation of benefits. A treatment cost estimator will be available to you as well. We did this with our son's tonsillectomy. We picked 2 facilities, wanted to see which one would cost more, and then we picked based upon the estimate, of course, but it was a nice little difference between the 2 of them. You'll be available to print off ID cards. You can look at our health portal that we have there. Also, with your FSA that is linked to Pacific Source Administrators, it'll give you your balance right available on there as well, so you know. Yes?
So I had Pacific Source with my previous employer, and I already have an InTouch account. Am I going to have to redo that and make it separate?
You will, because you'll have a whole new ID. Your old ID number is no longer, so you'll have completely different benefits, new ID number, everything.
So it's not going to confuse you guys to have 2 accounts with my name and birthday and all that?
No, actually, we have multiple. We have
Okay.
multiple members. And if ever there was a question, it'll also show that that member was termed at an old group, and
Okay.
your active member will be there for you.
See, Jeremy can attest to that.
If you have any chronic conditions, if there's anything that is genuinely, if there's something going on, there's a info on here on some of our condition support management. But I will say that if all of a sudden you find yourself or a dependent diagnosed with something or having issues health-wise with something, we do have a staff of nurse case managers that will walk with you through whatever you're going through medically. So that is a feature. I actually have the opportunity to go in the back and kind of listen to them on case calls. And it is just amazing that that's available to you. Also, we have on staff at every facility of Pacific Source, we have in-house clinical pharmacists. So in the event that you're going to 2 or 3 different docs and they're prescribing you drugs and they don't know that the other doc is prescribing a drug that could have an interaction, our team will get a flag to let us know this member is having could have a potential drug interaction. So that's available to you as well. The last thing I'm going to talk about is your application. It's important that we have these things filled out because we cannot change anything on your application. It has to go back to you if you miss something. So make sure that you won't know your group policy number, so you won't know that. You will know, if you don't know your date of hire, Barb can help with that. But please make sure you fill out completely the employee information, dependent information, social security numbers are federally required. Please make sure you put them on there. Your former carrier we know is Providence. You can just,
Do they have to fill out the prior information?
we know that. You can just write Providence. They're all coming in a large staff. We're gonna have the group number. We're gonna know. Just write Providence. If you're double covered and you're on a spouse's coverage, please make sure that you put that on there because they will be the secondary. And then lastly, this line down here, amidst all of this writing, is your signature line. We've got to get better about these forms. So this is the most commonly missed, is this employee signature. Please don't miss it. Okay? I can't sign your name or I would. I really would, but I can't, like legally.
So the question for you?
Yes.
Do you have video chat with the doctors yet?
We do not, but interesting, I overheard, potentially was eavesdropping, on a phone call regarding that.
Okay.
It is not available right now in 2016. That is all I can say.
Okay.
But I did overhear, yes,
So, we switched to the new insurance January 1st.
yes,
So I have a son that's turning 26 in March.
okay?
So I can't sign him up for this until he turns 26, or is it?
No, so he can be on this plan, and at the end of March, he will age off of the plan. To
Okay,
which will occur a qualifying event for him to be able to go and get on coverage of the zone.
okay,
Okay?
great, thank you.
Anything else?
Now, is the electronic communications agreement required to be able to go in and set up your own account online, or?
I'm not required.
The electronic communications agreement?
Oh, it is not
or the
required, it
application?
is not required.
Okay.
Yeah, it is not required. We love having your email addresses and we love having it, but it's not required. Date of birth, social security, signature, main information, required.
So that basically is just for communications
I don't
from
know what
Pacific
that
Source to
is.
the individual enrolled.
Correct. I did just see this picked up. This is a Global Assist, your travel assist. If you are 100 miles or more away from home, this is awesome. One of our colleagues was 100 miles down the road and realized she had left all of her prescription drugs at her house. And she called me and said, can you please send me a screenshot of this? To which I did. And she was able to get an emergency supply of her drugs that were coordinated for her at a pharmacy that she was able to grab them from. There are so many services. This is one thing I tell my kids, either have the app on your phone, type these numbers in, or put this with your Pacific Source card. Because this is just a great thing. 100 miles or more away from home, emergency services are available to you. As an addition, no charge. This is just a benefit for you. And sorry, I keep thinking of other things. We do have a mobile app as well. So after you get your In Touch for members all set up on PacificSource.com, you can take that username and password, log into your Pacific Source mobile app. Your cards are available online. You can see all of your benefits, where you are, as far as how much you've reached of your out-of-pocket, etc. Finding a provider, 24-hour nurse line, it's all right at your fingertips on your phone. Okay?
One other question. How does this travel assist relate with standards, travel med, or med travel?
They're both the same. They work the same way.
Okay.
And the big thing if you're, is getting you back here if something happens to you.
Okay.
Yes.
You want higher participation in the flex account now, right?
I would love higher participation. We are gonna talk about the flex account here. Liz Manley is gonna actually walk through that. Right now, we actually have pretty good participation, but if we're going to be going in this route and you're gonna be better health consumers, one of the first steps is actually doing pre-tax dollars towards your medical expenses. It's really a good idea, and we have the $500 a year carryover, so.
All right, perfect. So I handed out a couple of pieces of paper that look almost exactly alike. I want you to look at the one that says the flexible spending account at the top. So the flexible spending account, you've had in place for quite a while, and it allows you to do some great things with pre-tax dollars. It helps you pay premiums for yourself or your dependents, medical expenses that you owe out of pocket, and any also has dependent care expenses, so like for child care. So federal state and FICA taxes is what you're saving. It's about 30% in the lowest tax bracket. So anytime you can save some tax dollars, I think we're all for that. If you're just doing the premium portion, that's taken care of through payroll, so there's nothing for you to do there. If you want to do the medical expenses, then that is something that, there's really no other way to save tax dollars on medical expenses unless you write them off in your taxes. You have to reach an ungodly high amount to do that, and then you only get to write the amount after that off. So it's really not an option for most of us. So the flexible spending account comes to the rescue and allows us to put up to $2,550 away for medical expenses for us and our families for the year. Your family's expenses are all eligible as well, even if they're not covered on the insurance here. If they have their own plan, their co-pays, their deductibles are all covered as well and are eligible expenses for you to turn in. That's something that some people don't realize. So I just want to make sure that you're using it to its best potential. And as Barb said, you can carry over up to $500 in your health account from one year to the next. So $500 is a gimme right there, because if you use it, great, you've saved money, and if you don't use it, it's there for you to use the next year. So I would highly encourage you folks to look at least at that part. So then now we need to look at what your medical plan pays and see what is left for you as your responsibility. So what might you use that $2,500 for? So anytime you have a prescription, that's money out of your pocket, whichever tier it's on, whether it's a $10 copay or if it's on the second or third tier, whatever those are, and whether you're doing mail order or not, you don't have to put quite as much away. Co-pays for doctor's visits, deductibles for hospital, anything that you pay out of your pocket that isn't covered 100% already on your insurance. So any of those deductible amounts, any co-pay amounts, dentist, vision, all those expenses are eligible to be reimbursed through the flexible spending account.
Is that regardless of if they're a covered in-network provider or
Yep.
like if you
Anything
have to
out of
take
pocket.
like compounded medication?
Yep, that's fine.
Okay.
Anything, yes.
Isn't there eventually though that burns effect on your social security benefits?
If you are nearing retirement, you may want to talk to your tax advisor. I'm not so sure there's going to be Social Security for me when I get there, so I'm taking the savings now. But if you are in your last, I think, 6 quarters or something, you may want to look at that. Otherwise, for the rest of us, they did a study to spend years, but if you maxed out the account every year, the difference in your Social Security was not, it was, I'd rather save a whole bunch of money now than get a little bit more later on. Yes?
So if you lose your job and you have this money in your account, then what happens?
So you have a choice. You can, the participation ends on your day?
No, end of the month.
End of the month, okay. So whatever point you leave during.
Actually, no, it's termination date. That's all right.
Sorry, okay, I thought so.
Yeah, termination.
So on your day of termination, whether that's voluntary, involuntary, however it happens, you win the lottery and move to wherever lottery winners move. Your participation in the flexible spending account ends. So you may have used all your money, you may have not used any of it, you may have used some. You have the option to choose COBRA and continue making monthly payments in post-tax to keep your window of time open to incur expenses. That's a choice you have.
But, correct me if I'm wrong, they have the ability to submit expenses until the end of the plan year after date of termination.
That's
That
correct.
you cannot incur any more expenses. But say you quit in March, but in February you had some procedure done, you still have until December 31st to submit that receipt for the procedure you had done in February.
Actually, even to the next March because
2.5,
you have
yeah.
the 90 days
Okay, so if
afterwards.
you sign up and do the $1,400 or whatever the max is, and then you lose your job 2 months later, are you responsible for all that amount?
No.
Or,
No,
you're.
That is part of,
that's part of the risk factor.
There's-
Not this.
Oh, okay,
there's skin in the game for both parties.
okay.
The government gave less skin in the game for the employees, but there's a lot of skin in the game for the employer to provide this. And that is that we have someone that says, I'm gonna do 2550 and quits in January, you know, and has used it already, has submitted a claim from the first week of January for 2550, and then they turn around and quit. OSLC is on the hook for that, you know, whatever, 2,200. At the end of the year, we have to pay it.
But that doesn't come out of the plan paycheck.
No, we stopped doing that quite a few years ago. It was just,
There's two parts of the law, guys, on the Affordable Care Act. Originally, we could do $5,000, remember that? Put 5,000, that got cut in half to 2,500, now it's back up to 2,550. Yeah, just
Two
poof
more
it away.
holes.
And so, to your question, it goes to the point about, am I losing money because I'm approaching Social Security? I had $2,500 a year. Used to be at 5,000, some were even at 10.
Well, it was actually unlimited. The employer could set it at whatever they wanted.
wow.
So that's all gone away. And to the point, use it, remember the old use it or lose it?
Yeah.
Well, we got the gift a year ago of another $500 to be transferred to the coming year. That kind of went away too.
Yeah.
The chance of losing it is pretty minuscule at this point.
Is it a 3,000 max? Can,
Well, you can, if you roll over the whole 500, you can still elect 2550 for the next
Okay.
year.
For the next year.
But it doesn't just keep.
yeah,
Okay,
that's
keep
what I
going.
wanted to know.
Yeah.
Yeah.
So each year, all the more you can roll is 500, that doesn't accumulate, but it can be added to your next year's election.
So anything over 500 though, you lose.
Yes, that's true.
Can I ask you a coverage question? So if your son got braces in 2014 and you're making payments, is that eligible for
So
reimbursement?
it depends on how the contract is written for orthodontia. So we will reimburse however the contract is written. So if the contract states from December 2014 through March of 2017, you'll be paying $100 a month, we would be able to reimburse you $100 a month. If it says there's a down payment due, and then monthly payments are one payment a year, however it states on the contract is how we reimburse.
So it's not the incident itself.
Correct. Orthodontia is one of the few
Few.
things that's considered an ongoing service because you are supposed to go in and, you know, check the thing or whatever. Yes?
Yeah, the 500 that you transfer, is that now, it used to be till May, now it's good for the whole year?
So it is now, it's called, prior there was something called a grace period, which gave you an extra 2.5 months to incur expenses. That is gone away, and you have a carryover, which truly takes the money, up to $500, and adds it to your election for the new year. And you have the entire year to spend it. No time limit. Yes?
Can you opt out of the medical plan and still do the flexible spending account?
You can do the flexible spending account if you are eligible to be on the insurance plan.
Oh, you mean waiving the medical? Yeah. Yes.
So if we got this sheet, because we already are on it, do you want us
Yes.
to sign it?
You need to fill out what you want to do for the current year, where the blanks are on the bottom on the right-hand side.
Yeah.
You need to fill out how much per month and then what that would come out to annually and then sign it and get it back to Amy. Is there any paperwork for the HRA? Okay.
Or if you're an ODI only employee, do you get flex spending?
Yes. Oh, good point, good point.
That's a new thing.
Brand new, TFC, ODI, our, ISII has their own flex spending account, but TFC and ODI employees can now get flex spending. You're on our account, so for this year, take advantage of it.
So, let me jump now to, I'll come back to the flexible spending account. Let me jump real quick to the health reimbursement arrangement. So, as you have heard, your deductible is now $4,000. You are responsible for the first $1,400 of those types of expenses. That $1,400, if you feel like those are services that you would tap into and that you would be charged that deductible, if you foresee lab work or physical therapy or things that fall outside of the copay realm, then you want to think about putting up to that amount into your flexible spending account to help you cover that deductible. So you may have deductible expense you want to think about, you may have prescriptions, you may have orthodontia, you may have physical therapy, you may want to get those really cool glasses and you want to spend more. Those are all things that you are responsible for ultimately, and those are the things that you would want to put in your flexible spending account. Okay? The health reimbursement arrangement is, it's helping you after you reach $1,400 of your deductible. Some of you may not use any deductible. Some of you may just use a little bit. Some of you may use it all. So that could come into play. It won't necessarily for you. So we'll get back to that a little bit more. But so for your flexible spending account, for the health account, you want to figure out all those amounts that you pay during the year, that you will estimate you'll pay during the year. I know it never turns out exactly the way we think, but it's great to have an opportunity to put some money aside in the flexible spending account to cover those health expenses. It is available, any amount that you put into the flexible spending account of your own dollars is available to you on the first day of the plan. You don't have to build up an account. January 1st comes and you need to go do something, or February 3rd and you're getting LASIK surgery. Whatever it is, that amount is available to you at the start of the year. So you don't have to wait for it to accumulate. When you have the expense, turn it in, get reimbursed. That's the beginning of the plan.
Now, when you say turn it in, we turn in our expenses to you, Barb?
Oh, God, no.
Send them on the Barb.
Yeah, no.
They go directly to Pacific Source?
No. Administrator.
Yes, Pacific Source Administrator. So those of you currently that are participating in the flexible spending now probably have a Benny card. Okay, the Benny card is great for some people. Some people it is not their friend. So if it doesn't work for you, I say put it in a drawer and don't use it. If it does work for you, great. You can use it when you go to the pharmacy, go to the doctor's office. You can use it once you get your explanation of benefits back and the bill from your provider to make sure they match up. You can write it on there. The Benny card, since you have Pacific Source Insurance, will do a lot more matching, which means a lot less letters to you asking for more information. So that's a great thing to have both the Pacific Source Medical and the flexible spending
The
account.
submissions of copies of the receipts and the EOB.
Right, so basically what we need is
email?
something, yes, we need something that shows date of service, what the service was, and the amount that was your responsibility. The explanation of benefits gives us all of that. You can use your Benny card to pay for it and make sure you retain your information. You can turn in a claim. You can go online and submit it electronically.
Which
So
is
that's
very
great.
easy.
So easy. So
Very
nice.
easy to do online.
Yes.
On the prescriptions, regarding naturopath, going to a naturopath, in my experience, they, okay, thank you.
She sees me doing this.
Don't go there.
What was the question?
I don't know. What was
Well, naturopaths prescribe a lot of vitamins.
Right.
And so they're expensive.
Right, so those are eligible if you have a diagnosis, and if they're used to treat a particular condition, disease, illness, or injury. If they're general wellness, they're not eligible. But you would need a new letter each year saying which vitamins and what your diagnosis is.
Remember that ICD-10, CPT-4? Those diagnostic codes, they need to write them for that.
So her naturopath could say she's a very depressed person, she needs vitamin D3 daily,
It's-
and that would count.
Ally bills, you're gonna have to bill it.
Okay.
And they're gonna
Letter
have,
of medical necessity.
they're gonna have to do,
And then a letter of medical necessity.
right,
It's a form that you take in and says, I'm prescribing this to her for this diagnosis,
Yes,
and
right.
signs
so
off on it.
talk
The
to your
doctor-
doctors. Many alternative care providers have never done this before. They need to learn how to do this. If you want to be able to have it covered.
St. John's Wort.
What was that for again?
You said it's
Third-party
90%.
authorization forms, do you have any of those available, or are they on a per-person basis?
They would be, I don't know that we have those on our website, but we can certainly get those. So you can, so someone else can talk about
My
your
husband,
account.
for instance, if he has a problem, or if I have a question on his EOB, they will make a call and inquire, I need to get a separate third-party authorization.
It's called a PHI form, and I can just send
Personal
that to you.
health information.
The
Sure.
personal health information that you're like electing your, someone to have access to your personal health information or PHI.
Or contact our offices and speak with Christine, and she will help you with that. Christine's still the go-to.
Now, if you have adult dependents that are on your coverage, say they're 22 years old, do you need one of those for
Yep.
that
Yep.
individual as well?
Is it
If
15
you
years
want to
old?
be able to talk, yeah.
15 years old or older, mom, dad, don't get mad. They will actually leave the room and you will be so mad.
And then you want to find out about your daughter's medical tests that you're definitely interested in, and she could care less, and you get to sign a PHI form. Yep.
Is there another question?
Can you repeat what needs to be on the receipts again prior to?
Sure. Data service, because we need to see that it falls on your, within your plan year, what it was, so we can see that it was, and when I say we are doing this for you because that is the IRS rules. We're helping you to make sure you're compliant. So we look for the type of service it is to make sure it falls within the eligible expenses, and then what was your responsibility. So $10 copay, it went to deductible, how much was yours? So that's why the explanation of benefits, if it's something that goes through the medical plan, tells us all that information.
And
Also, the
heads
name of
up,
the patient, name of the patient as well.
name of the
Your
patient.
EOB has all that information on it.
Everything.
Use that.
Yeah.
But if
Sometimes they
you
don't give you
use
an
a
EOB.
receipt
You should
from
get one
a
in the mail.
You
provider,
will get one in the mail
You'll get one
or on
from
our
the
they don't
website.
say what the service is, you're in trouble. I mean, even though it says Oregon Urology, and you wouldn't go grocery shopping there,
Yeah.
they're still gonna wanna know, what did you do at Oregon Urology?
Yes.
So on the Pacific Service website, we can get that information, like.
All of your
EOB,
EOBs are electronic.
How long does that process take?
Generally, the turnaround on an EOB is a couple days. It'll
Depending
take-
on when the provider sends the information.
It's always dependent on the provider, but if the provider wants to get paid, the provider typically has a pretty quick turnaround on it. And so usually within, I would say within 30 at the most, you'll have an explanation of benefits. But even, yes,
Sooner.
But this is when I say, don't pay your doctor bills until you get the EOB.
right, this is the
Don't pay
key.
the doctor bill until you get your EOB, because they may not, when they bill the insurance company's gonna send you an EOB, and it'll tell you what you actually owe. Because your doctor bill won't tell you what you actually owe, it's gonna tell you what they charge you.
Right.
Don't pay that.
But there's a write-off portion that if they're if we have a contract with them, they're one of our PAR providers participating, we have a negotiated rate with them, that will, you'll see a portion on your EOB that says provider write-off, and that's because they wrote off a portion, what the insurance carrier paid, that's what we would take, and then it'll at the very end say your portion.
Okay, we're gonna move forward because we're going long.
So the flexible spending account, again, if you have dollars that you're gonna be spending out of your own pocket, it's a great deal. And like I said, you can use a bank card for those expenses. However, for the health reimbursement arrangement, and again, another page looks a lot like the others, it's gonna tell you that you are responsible for the first $1,400 of deductible per person up to a family maximum of $2,800. And then the employer will
What,
kick in.
family maximum of 28? No, 52.
Two times.
No, threshold. They would have to pay
Oh, 1,400 times 2, gotcha.
Okay.
I'm like,
So the most you would have to pay out of pocket in this whole deductible thing is $2,800 if you have at least one more person on your coverage. If it's just you, $1,400. The company then picks up the remaining either 26 or 5,200. Okay? And again, these are expenses incurred during the calendar year. It goes with your deductible year, so you'll be able to track those. So now there is a couple of different ways that you can go about making sure that we know about your deductible expenses. So if you if you use your Benny card, we're not going to know what you're paying, maybe you're paying part of a deductible on one of those expenses, because that's not going to hit our system the way it would if you turn in a claim. So if you can either send your explanation of benefits in every time you get one so we can track and make sure when you reach that 1,400, or if you don't want to use a Benny card for your FSA, you can sign up for what we call Easy Pay.
This is awesome.
So if you're just doing the HRA, I would suggest that you strongly consider signing up for Easy Pay. What happens is the provider sends in the billing information, the medical side processes it, creates an EOB, then a file kicks over to Pacific Source administrators, and automatically we will track that deductible month for you. Once you hit the 1,400, we will automatically send you a check for the amount above it. So if all you're doing, if you're not doing the FSA for whatever reason, I would strongly suggest that you do Easy Pay for your HRA dollars.
So you have two plans, guys. The flexible spending account for those expenses that you know you're going to have that year. Glasses, co-payments, those types of things. Your health reimbursement situation is for the medical side. So you go to the doctor, you go to the hospital, and they're going to see you have a deductible of $4,000. Don't try to explain it to them, okay? They won't get it. You have a $1,400 deductible, okay? Anything over the $1,400 for the next $2,600, this company's going to send this company a bill to pay, okay? If there's money left over up to another $2,000, you're going to pay that. That's $6,000 maximum total out of pocket, about $300 less than what you were paying a year ago, and then you paid it 100%. Two plans. One is those expenses you know you're going to have, and this is the hospital, the medical side, that's a deductible expense. Deductible expense. Those things where the asterisk is not there, those are deductible expenses. And once you reach the first, you're going to pay the first $1,400 of deductible expenses, next $2,600, next $2,000,
It's $3,400.
and everything is paid.
So I'm still trying to understand how the payment happens. So you pay the first 14, and then you don't have to do anything else with anything.
Until the next $2,600 is paid.
Done behind the scenes.
Right.
Well, it's
You don't
paid
have
done
to do
behind the
anything.
scenes. You're still going to get the bill for
You're going to
it,
get a bill.
So we're gonna get a bill.
and you're going to get money for it that you can use to pay the bill. So you're going to get reimbursed out of the health reimbursement arrangement, that other
So we still pay
$2,600.
it first and then we get reimbursed?
No, you don't have to pay it first.
You don't necessarily have to pay it first. Usually your doctor, when you get into those types of expenses, will bill you and wait to see what the insurance pays.
Okay.
By the time that happens, and then you finally get the bill from the doctor, you will already have the money in hand, so you shouldn't be out.
So there, but we don't have to submit anything.
If you sign up for Easy
You may
Pay.
have to.
You have
You go to the hospital, you're gonna submit stuff, because the company's not gonna know. They don't get to know. So you're gonna get that $10,000 doctor bill.
Okay.
You're gonna pay $1,400. You're gonna send it to, or sign up for Easy Pay. They're gonna send a notice for payment for what the company's gonna pay. You're gonna get a check. Don't go to Vegas.
Pay your
So
medical.
that's kind of what I was wondering.
Yeah, you're gonna get a check.
And then anything that's left over that.
You're gonna pay the next $2,000.
$6,000
Yeah.
to equal out to 6,000 and nothing more after that. Okay,
Yeah, you're tracking perfect.
okay.
So you get that check for $2,600, sends it to the doctors or the hospital.
But in order to get that check, you have to submit your.
You may have to submit something unless you do the Easy
Depends,
Pay.
yeah.
Unless you do the other. If you have the FSA though, you won't have the.
Well, you can still do the easy pay, it would just do that, it would do that same process for the FSA as well. And that means that you can't use your card, but if you sign up for easy pay, every EOB that comes to us, we're gonna look at, is it deductible? If so, yes, we're gonna track that towards your 1,400.
Okay.
And if it is deductible, then we're gonna kick it over to pay out of your FSA.
Okay.
If it's not a deductible, if it's a copay, then it's gonna go straight to your FSA and pay out of there. Either way, you would get a check.
So with Easy Pay, it covers for both the FSA
Yes,
and
yes,
the.
yeah, you can't distinguish, you can't just say, I want easy pay for this one and a card for the other.
So
It's all
that's
around.
why we're enrolled in both. And then with that, we don't have to do anything except submit the bill, or is it already?
It's already, the only thing you would need to submit is if something that wouldn't go through the medical plan. So any dental expenses.
If you wanted it up for your FSA,
If you wanted it for your
Right.
FSA outside.
Yeah, any of the deductible stuff would.
Yeah, outside of the
taken care
deductible
of.
stuff.
Outside of the deductible
Yes.
stuff.
You would have to submit those.
Well, no, not for copays. You would just pay those.
So if you got glasses, or if it's a chiropractor,
Right.
or if it's all
Right.
this, and then if you sign up for Easy Pay, it all goes through that, and then there's no submitting of EOBs or.
Correct.
Okay.
just
Just
so
remember,
folks.
you have two accounts.
Yeah, it's coming into accounts,
But
but
they work,
there is no,
They coordinate.
Just so folks know, this HRA is employer-owned, and it's not this magic pot of money sitting aside that you guys get to use for whatever.
Right.
It's only accessed when you get to that point where you're past the $1,400 deductible, and then we're paying the bill for $2,600. If you don't use it, it just rolls over into next year's premiums. It's not like you're gonna accumulate anything, it's not yours. We're doing it for you, but it's not yours.
It's a technique we use to keep the premiums from being at 19%.
so if you didn't put the whole 1,400 in your FSA.
You're not tapping into the HRA.
You don't want to put $1,400 in your SFA.
Well, it should
Why?
be reasonable.
Why would you? You don't know you're going to the hospital.
No, but if you tend to reach your deductible, it's a good idea.
Yeah.
Depends
If
on.
you have a history of always reaching your
If
deductible.
you didn't put that amount in, though, the FSA would only cover to that, and then you'd be responsible up until.
1401.
1401, and then the HRA.
And then at 4001, it's back on you again until 6,000.
Okay.
But understand, you don't get the $2,600. That's the company's money
You
they're
don't
using.
get that, but, right.
It's available should you need it.
Okay.
I was just trying to see the different ways it could work, like, just with your FSA, if you didn't
Right.
put the whole thing in.
Yeah.
You would still be responsible for
Yes.
that amount, up until.
In the back.
There's a couple.
have to enroll into the HRA for the
Yes.
FSA, or does that automatically happen?
It's automatically happened. If you've got medical coverage, you're part of the HRA program.
And Lady in the Red.
Yeah,
heard
in
you.
the back. Yes.
So, just to be clear, I understand now about the HRA, but with the FSA, you still have to submit for that, right?
Depends on if-
Easy Pay.
Yeah, it depends on if you have a debit card or not. If you sign up for Easy Pay, you don't have to submit. If
Right.
you don't do Easy Pay, you either have to use your Benny card or submit manually or through the website.
Why would we not, I mean, there's no sign up for HRA, so why not everyone just have the easy pay?
Yes.
Okay.
So Easy Pay, did you just
I
say
got-
that if you have FSA, let's say you have money in FSA.
Okay, here.
You have money in FSA,
Yeah.
and if you're not, you're using that for non-deductible thing. Like, you could use it for deductibles or not.
Correct.
Did you just, so if I go get glasses that aren't covered, do I not have to submit a receipt for that?
No,
And
you
the
do.
money's gonna come to me?
You do.
You do.
Okay.
It's outside of the medical.
Okay,
That's
so
because
the FSA is, like, I have it currently. I log in, I submit my receipts, it's all lovely. This Easy Pay thing, different website, different.
It is a different way for you to get reimbursed. So it is something you sign up for when a provider sends their bill to the medical side to be processed. Anything that's on that explanation of benefits that shows as patient responsibility will automatically reimburse to you up to the amount in your FSA.
Okay, so it doesn't have to be a deductible, it
No.
could be a code.
Correct.
So if I said,
You can't have both though.
It just
Can't
tracks,
have both.
you can't have the card and Easy Pay.
no, I understand the card, not a card, don't like a card.
Okay.
So, obviously, it's not gonna cover my glasses, because you
Right.
received
So
that.
even
But
if you
I
are,
were deductible,
if you're doing something that is outside of the medical plan, you can still submit manually.
Yep.
You can still
Like
go
you
on the
do today.
website and
Right.
submit for your
Right.
glasses out
You
of
just
the-
don't
inside
have
the medical
the
plan,
Bennett card.
like a copay,
Right.
or
Those things
a
will come through
deductible, those are
automatically.
automatically gonna,
But if you're getting
but they're gonna come
orthodontics
out
or
of my
something.
FSA.
Yeah, they're gonna
Yes.
wait for your UOB and they're gonna
Yes.
funnel right through the Easy Pay system.
They'll figure out what you owe.
And you guys will keep track, like, for all the deductible expenses, if I hit 1,400, then you start sending me checks out of the HRA.
Right.
Not not.
Right.
You got it.
Right.
Yep.
Question right here.
Is that me?
Yep.
So it says participating retail stores, for the Benny card, supermarkets and pharmacies, if you just like buying contact solution at Fred Meyer's.
Yeah,
you
you
have
need
to
to,
pay-
you should go to the pharmacy section though, not to the general registers. Because it goes by the type of code that's in the register itself.
And we need our name on the documentation.
Well, so you need to have, if you're just turning in a receipt, we need to have a claim form. But if it comes through the medical, we'll know that it's you. Right? I mean, what kind of receipts are you talking about?
A Fred Meyer receipt.
Contact solution.
Oh, no, just a cash receipt.
Have you
Yeah.
submitted electronically online and filled out their little form and scanned in the receipt?
It's just the receipt doesn't have to have
It's
your
so
name.
Yeah.
easy.
It's so
Store.
easy.
It's the easiest, I love it.
Yeah, if you need, I will show you. It is really cool.
Right here.
Yeah, currently, I send in, I'm old school, so I still fax.
Sure, that's awesome.
But then I get, direct deposit into my account. So does Easy Pay,
It would still go follow the direct
so
deposit.
my $30 for that doctor visit will just appear in my checking one day?
Yes.
I think there's one more question right here.
Barb, you mentioned that ISII has its own flexible spending account. Is this replacing whatever we had before?
No,
No.
you will
I
continue
was
with
gonna say.
And it's
yours.
being added. We are going to talk to John.
Okay.
Your plan is going to be through ISII. Since you're already set up with Manly or PSA, that plan continues and you're adding on the HRA. OSLC, ODI, and TFC will have another plan. So there's really two plans here. Same
I
medical.
didn't do it.
Same medical.
Okay.
Same medical plan, it's just you guys are dealing with PSA on your own. It's not gonna be part of OSLC's
Okay,
PSA plan.
okay,
I talked to John.
okay.
Trust me.
All right. So I guess maybe a little bit bigger picture than that, and this might be for the actual insurance company. This goes to what I mentioned about affiliated service groups. And I know, like the Nonprofit Association of Oregon has advocated pooling small nonprofits, but they're being investigated for that it's
Yes, they are.
not
I'll answer this.
working. So why do we think that we're an affiliated service group having these different entities? Because my fear would be some affiliated entity has substantial claims and then retroactively
We're gonna have
has
this
to come
discussion
back to
outside.
an audit.
We're going to, this is sidebar. You're not.
Okay.
Okay.
Yeah,
Actual sidebar. We'll talk about that.
after the meeting.
We'll talk. Okay. Other questions, guys? Thanks very much, everybody.
Thank you.
Oh,